We're going to be talking about if your hearing aid is not working, if it is dead, what to do. It does not necessarily matter what style of hearing aid you have. We have a few different styles shown here. The principle is still basically the same. We'll start out with a typical in-the-ear style. This is a canal style or half-shell style hearing aid. First thing you want to do is check the battery, and you can do that by simply putting a battery in there, or checking the hearing aid with the battery in it, and if the hearing aid is turned on, it should whistle in your hand, as it is doing now, and that's one way you can tell if the battery is working or not. However, if the hearing aid is dead, that's probably still not going to be the best thing. You're going to need to check a little further. So the next thing we're going to do is to check to see if there's any wax in the hearing aid. So the best tool for that is a pick that you would have gotten with your hearing aid. It has a little wire loop on the one end of it, and you want to simply put that into the receiver opening in the hearing aid, gently going in there, probably about half the distance of the tool. Just insert it, spin it around, pull it back out again. If there's any wax that was in there, it should come out with that motion. So that would be something to try. And same with a behind the ear style where you have an ear mold. Same concept with the wax removal tool is to simply insert it into the ear mold, pull it out, the receiver opening. There are actually in ear molds two openings. One is a vent opening, one is a receiver opening. Always good to just check both. And again, just insert it, twist it, pull it out, and if there's any wax in there, it should come out with that motion. And that basically covers any type of behind the ear hearing aid or in the ear hearing aid as far as checking for wax. Another topic we'll address is if a hearing aid is whistling or has feedback, another word for that whistling sound. And it can be due to probably three main things. First thing we want to check is if the user or patient has a wax problem. So using an otoscope, we'll look in their ear to see if it's wax that might be causing the problem. Secondly, it could be that the hearing aid is not fitting tightly, and it can be the mold on a behind the ear hearing aid, or it can be just the hearing aid itself in an in-the-ear style hearing aid. The third thing is there could be actually something wrong with the hearing aid. Internal feedback, which is a problem in the hearing aid, can also cause a hearing aid to whistle. So it's a matter of process of elimination with those sort of things to figure out why the hearing aid is whistling. If you have trouble with your hearing aid being intermittent or cutting in and out, there's a couple of things that can be checked in that regard. First of all, you would want to see if your hearing aid has a weak battery. So just the best policy in that case would be to just go ahead and change the battery, see if that solves the problem. Another thing you could check is by opening up the battery door and checking if the battery contacts inside are corroded. That could cause a hearing aid to be intermittent. In regards to battery doors, the other thing you want to make sure of, whether it be an in-the-ear style or a behind-the-ear style, is that the battery door is completely closed. It should snap tightly shut. Same thing on an in-the-ear. Again, you want to make sure the door is completely shut. The volume control on the hearing aid, there could be something wrong with it. So another thing would be that it could be intermittent because there's a short in the volume control, something that would need to be sent into the manufacturer for. Also, on a hearing aid that would be behind the ear, there could be some moisture in the tubing. Either type of hearing aid like this, you would want to check if there's moisture in the tubing. Another problem that could be happening with your hearing aid is that the sound could be distorted, not sounding clear. A few things to check, again, regarding whether you have an in-the-ear hearing aid or behind-the-ear hearing aid. Same things apply. The battery could be weak, so the best thing to do is just change the battery, see if the sound quality gets better. You could also check to make sure that the receiver openings on an ear mold or on an in-the-ear hearing aid, that they are not plugged. So go ahead and do your cleaning process with your cleaning tools to make sure that those openings are clear. Also, it could be that the ear mold or the hearing aid is not fitting properly. That can cause distortion of sound as well. The hearing aid could also not be in the correct program, and so you want to make sure by checking the other programs if you are in the correct program or not. Also, you would want to again double check moisture to see if there's moisture in the tubing. On a behind the ear hearing aid of this sort, it's usually rather evident that there's moisture in there, and you can get rid of it by pulling apart the hearing aid from the mold and using a recommended blower to remove that moisture. You don't ever want to blow into it to try to remove that moisture. You'll just create more moisture in there. With an in-the-ear style, not really easy way to check for moisture. You're just best off just to put it in the dryer, see if that takes care of the problem. You also want to check the battery contacts in the hearing aid. In the ear style, you can go ahead and look in there, see if you see any rust. Is usually any kind of a brownish color or a whitish color is a sign of corrosion. Same thing on a behind the ear hearing aid, just opening the battery door and looking inside to check and see if you see any corrosion or moisture in there as well. A couple other problems that can occur with your hearing aid is that you are not happy with the overall sound of the hearing aid. You have difficulty understanding speech, or you have trouble hearing in noise. Those are problems that you do want to contact your audiologist for, because it may require some changes in your programming. Please make an appointment.